General medical conditions, common infectious diseases, bacterial infections. The immune system. The immune system is a complex network of cells and proteins that defend the body against infection. The immune system keeps a record of every germ or microbe that it has ever defeated so it can recognize and destroy the microbe quickly if it enters the body again. Abnormalities of the immune system can lead to allergic diseases, immunodeficiencies, and autoimmune disorders. There are a collection of disease fighting cells that neutralize foreign substances. Illnesses result when the immune system does not neutralize foreign substances, also known as antigens. There is a cell mediated response, the humoral immune response, the beta cells that produce antibodies, or nonspecific immune response, which is inflammation. There is an autoimmune response against the body that leads to damage of the body's own tissue. Vaccines are divided into four general classes. Those that are containing living infectious organisms, which are either disabled or otherwise non-virulent strains. Those containing infectious agents killed by physical or chemical means. Those containing solutions of toxins from microorganisms that may be used directly, but that usually are treated to neutralize their toxic potential. And finally, those containing substances extracted from a portion of an infectious agent. Let's start with some bacterial infections. Pharyngitis is also known as a sore throat. The etiology, it is caused by the Epstein-Barr virus or by the Streptococcus bacterium. It's transmitted by direct contact with an infected person. Signs and symptoms typically include pain with swallowing, fever, inflamed and swollen glands, malaise or fatigue, and weakness. The mucous membranes of the throat and mouth may be inflamed and covered with purulent matter. The management for pharyngitis is a throat culture to determine the presence of the streptococcal infection. Topical gargles and rest. Antibiotic therapy for streptococcal infection may be necessary. Tonsillitis. The etiology is an acute inflammation and bacterial infection of the tonsil epithelium. The signs and symptoms. The tonsils appear red and swollen with yellow exudate in pits. Many individuals will have pain while swallowing, high fever and chills, as well as headache and neck pain. Sinusitis, otitis media, and tonsillar abscesses may also develop with this condition. For the management, we will collect a culture to check for staphylococcal bacteria, and if present, use antibiotics for 10 days. Gargling with saline water, a liquid diet, and antipyretic or fever-reducing medication. Frequent bouts of tonsillitis may result in the removal of the tonsils. Diphtheria. Starting in the 1920s, diphtheria rates dropped quickly in the United States and other countries with the widespread use of vaccines. In the past decade, there were less than 5 cases of diphtheria in the United States reported by the CDC. However, the disease continues to cause illness globally. In 2016, countries reported 7,100 cases of diphtheria to the World Health Organization, but there are likely many more cases as they are underreported. The causes and the transmission. Diphtheria is an infection caused by a bacterium. Diphtheria spreads from person to person, usually through respiratory droplets, like from coughing or sneezing. Rarely, people can get sick from touching open sores or skin lesions, or even from clothes that touched open sores of someone sick with diphtheria. A person can also get diphtheria by coming into contact with objects, like a toy, that has the bacteria that caused diphtheria on it. The incubation period is 2 to 5 days. The signs and symptoms of diphtheria, including thick, patchy, gray or blue-white membranes that form over the mucous membranes of the pharynx, larynx, tonsils, soft palate, and the nose. Often, children with diphtheria will present with a swollen neck. The bacteria that causes diphtheria can get into and attach to the lining of the respiratory system, which includes parts of the body that help you breathe. When this happens, the bacteria can produce a poison that can cause weakness, sore throat, fever, and swollen glands of the neck. The poison destroys the healthy tissues in the respiratory system. The dead tissue forms a thick gray coating that can build up in the throat or nose. Medical experts call this thick gray coating a pseudomembrane. It can cover the tissue in the nose, tonsils, voice box, and throat, making it very hard to breathe and even swallow. The poison may also get into the bloodstream and cause damage to the heart, nerves, and kidneys. Complications from diphtheria may include blocking of the airway, damage to the heart muscle, damage to the nerves, loss of the ability to move, lung infection, and in some people, diphtheria can even lead to death. Even with treatment, about 1 in 10 diphtheria patients die. Without treatment, about half of all patients can die from this disease. Tetanus. This can cause a condition called lockjaw. Tetanus is caused by a bacterium. Tetanus grows in the absence of oxygen in the soil, dust, feces, and even saliva. We most often get tetanus through puncture wounds, lacerations, and burns, but we can also get it through contaminated injections, such as drug use. The signs and symptoms of tetanus include abdominal rigidity, followed by painful contractions, primarily of the masseter and the neck muscles. The jaw can become rigidly fixed, the voice is altered, and the facial muscles contract. The most common signs and symptoms of tetanus include muscle rigidity in the back and the extremities. In the final phase, tachycardia, profuse sweating, and high fever occur. If we come into contact or are injured with anything that has rust, or we have been in soil and we have open wounds, we should cleanse the wound using standard wound care procedures. A booster shot of tetanus within 72 hours can be administered if a previous booster is greater than 5 years old. Typically, we get tetanus shots every 10 years. Pertussis is also known as whooping cough. This is caused by a bacterium, Bordetella pertussis. The incubation period is 7 to 10 days. This is an extremely contagious respiratory infection. There are 3 stages of whooping cough. The insidious phase, or catatorial, proximal, which is sudden and periodic, and convalescent. Pertussis is extremely dangerous for young children and especially babies, so it's important to have the pertussis whooping cough vaccine prior to holding any newborns. Influenza Type B. This is an invasive bacterial disease and the leading cause of meningitis in children younger than the age of 5. This can cause several serious illnesses. The transmission is through respiratory droplets or person-to-person contact. The signs and symptoms, if an organism leads to meningitis, could be fever, chills, malaise, headache, and vomiting.